Diabetes affects millions of people in South Africa and can lead to multiple health complications like blindness, kidney failure, heart attacks, and strokes. These 24 diabetic patients meet here at this community healthcare center east of Johannesburg every month. The group is led by health promoter Gwen Nyati.
We're trying to group the support group together so that they can teach each other about this disease. Also, the family, they must know about this disease.
Today, Gwen is discussing healthy eating with the group, focusing on how to best approach sugar. Making sure their sugar levels don't drop too low or spike too high is a daily struggle for diabetics. Managing the disease properly requires hard work, dedication, and education around how to implement a healthy diet.
Eating puts glucose into your blood. If you have diabetes, you must be careful about what you eat, how much you eat, and when you eat.
Endocrinologist Dr. Sandeep Ruda says lifestyle changes and making healthier diet choices are key to both avoiding diabetes and managing the disease after diagnosis.
In terms of diabetes, we're saying 422 million people worldwide. It's almost 500 million. It's the biggest epidemic we've seen in the world in the history of mankind, more than bubonic plague and cholera and everything we've seen before. But how come it doesn't get the attention it ought to? Because it's silent like that. It's driven by choices in society.
The group has had a positive effect on its members, who now feel more equipped to navigate living with diabetes.
It helps them because now they can control their diabetes by doing exercises, eating the correct food, also trying to reduce the weight.
Jerry Mabena has been diabetic for the past 10 years. Every month when he attends the support group, he first has a quick health checkup with the nurse. Today he's having his blood pressure and his blood sugar levels tested. He says water is the secret to keeping his sugar levels stable.
What I've learned is to drink more water every day. Then you can be healthy.
Choices these patients make now and lifestyle changes they implement to manage the disease are critical. Gwen pays special attention to what kinds of beverages the support group members drink. Today she's teaching them how to ensure they don't take in too much sugar through sugary drinks.
Drink water or diet cold drinks rather than sweetened cold drinks or fruit juice that contain a lot of sugar.
Elaine Mokwena, who has been diabetic for 17 years, has implemented some of Gwen's lessons in her day-to-day life. Education around how much sugar is in sugary drinks has changed the way Elaine now approaches drinking juice.
I take half, then I put a lot of water, then I drink it. Because I don't want to eat a lot of sugar on my blood system.
Juice has got the high sugar levels. So they must, also if they drink the 100% juice, they must pour water. They must dilute.
If they weren't being so diligent, the consequences could be deadly. High blood pressure and high blood sugar levels can put strain on the body's arteries, leading to further complications.
And what happens is you develop an area of damage in these arteries which form a clot, an area of healing. We call it atherosclerosis. So if the big artery to the brain blocks, you get a stroke.
Working together to avoid negative health complications, members of the support group like Jerry and Elaine have found that there's strength in numbers.
It's whereby we got chance to talk about our different illness, sugar diabetes. So each and every one, when we discuss, we find out it's more easier. You learn more, not on your own,